Um, there are some topics that come into this hall that are just fun, and there are a lot that come and are curious or enlightening or stretch your mind in different ways. But every once in a while we have a topic that so points out the critical nature and importance of education that it's almost frightening. South Africa has been an extraordinary country, I think, to all of us, superhuman in its efforts at liberation and freedom. And God must have thought that they did such a fabulous job in overcoming apartheid that he would see how well they did in AIDS, and they could set the course of the world in terms of how they deal with educating their populace and overcoming something that is such a scourge to their population as well as to all of Africa and spreading into Asia and many other parts of the world. So this is a topic tonight that is quite sobering and quite critical, and which we're very anxious to hear about. I want to thank the panelists for being here, some of them from great distances, and for some of them it's a bit of a homecoming, and we're delighted for that. And I want to introduce to you Suzanne Grant Lewis, who is an assistant professor here at the Harvard Graduate School of Ed. And if you go to some obscure corner of the world, you may very well bump into Suzanne Grant Lewis. She is in lots of interesting countries doing extraordinarily interesting work, whether it's trying to educate young women in Afghanistan, or the work she's done in Africa, Asia, all sorts of places. Suzanne really knows how important universal education really is. She's going to introduce the panelists and lead us in our conversation tonight. And again, welcome to you, and hearty welcome to all of our panelists. Suzanne Grant Lewis.
Yes, thank you very much. Good evening. It's my pleasure to introduce the panelists and to provide you with an overview of the panel for this evening. Before I do that, let me just introduce our topic a little bit. It's been 21 years, 1981, since the Centers for Disease Control published a report on the first AIDS cases. Since then, 60 million people have been infected. 25 million of those people have died, and we now have 13 million orphan children under the ages of 15, according to the latest UNAIDS Interagency Task Team report on education. It's estimated that 70% of the adults and children living with HIV/AIDS are in sub-Saharan Africa. But the recent projections by the National Intelligence Council warns us that by the year 2010, the center of the crisis will no longer solely be based in sub-Saharan Africa. HIV and AIDS are on the verge of exploding in 5 of the most populous countries in the world and could produce an estimated 50 to 75 million cases by the end of the decade. One sobering statistic is that 1% increase in the infection rate in India and China yields another 20 million cases of HIV/AIDS. As we know, HIV/AIDS is more than a disease. It's a development disaster, hampering our efforts to improve the welfare of people in the developing world, and indeed in reversing the gains that we've made over the last 3 decades in improving the social, economic, and cultural conditions under which people live. To provide treatment to those infected is beyond the means of most societies in the world, and many societies are finding it difficult to cope with the devastating impact of HIV/AIDS. Well, today we're going to speak of hope by focusing today on the role that education can play. We're going to focus on the continent that today is so ravaged by the pandemic, and specifically try to ground our discussion by turning our eyes to South Africa. I'm very pleased to welcome our panelists who bring considerable knowledge and experience in working in HIV/AIDS education to share with us today. I'll introduce the panelists, and then Dr. Sikhakhane will provide us with a short introduction to the AIDS situation in South Africa. And then we're going to explore a series of questions. So I will pose the question, and the panelists in turn will provide responses. Following that, we'll then open the floor for discussion, and I hope that we'll have at least half an hour for discussion with you all. Okay. First on my left is our esteemed alumnus, Dr. Bhekinkhosi Sikhakhane. He's a South African principal in Dundee in Northern Natal and a national leader involved in educational transformation in South Africa. Dr. Sikhakhane is a board member of an HIV/AIDS clinic initiative in KwaZulu-Natal, which runs a clinic for HIV-positive women and promotes mother-to-child AIDS prevention. He earned his doctorate here at the Harvard Graduate School of Education in 1997, and I'm saddened that I only arrived after he left. Through his involvement with the South African Democratic Teachers Union, SADTU, as well as his long-standing work with Judith Baker and the National Writing Project, Dr. Sikhakhane has been engaged in efforts to promote the empowerment of teachers. He serves as a consultant for UNISA, Rand Afrikaans University, Vista University, and Pretoria Technical. And we're very pleased that he was able to visit the United States. He's here for a conference on the National Writing Project, which is taking place in Atlanta. But we're so pleased he was able to come to Cambridge and come back home. On his left is soon to be, or maybe not soon enough, Mr. Alistair Witten, who is a doctoral candidate in the Community and Schools program in the Administration, Planning, and Social Policy area here at Hugsy. He earned his master's degree last June in school leadership. Alistair has more than 20 years of experience teaching and leading schools in Cape Town, South Africa. So we have two different provinces represented here across our South African colleagues. Prior to arriving at the Harvard Ed School in September 2001, he was the principal at Zerilda Park Primary School in the rather tough township of Lavender Hill. Here he redefined the school-community relationship, building a partnership that served the community and helped secure the school environment. This led to the Safe Schools program, a program which he coordinated for several years and is now extends to 200 schools in the Western Cape Province. Alistair is very interested in developing models for mutually beneficial school-community relationships. And on Alistair's left is Dr. Charles Deutsch. Charles is a senior research scientist in the Health and Social Behavior Department of the Harvard School of Public Health. Prior to earning his doctorate in behavioral sciences, Charles was a teacher. We always like to point this out here in the Asquith forums, as well as a welfare rights organizer. He developed an alcohol education program for teenagers that was replicated nationally, and he helped develop the first comprehensive secondary school health curriculum, which the Centers for Disease Control found effective in influencing students' knowledge, attitudes, and practices about health. And by the way, it's in use in Boston and Cambridge schools. He's currently the principal investigator for a CDC-funded project, Global AIDS Program, which he's engaged in collaboration with the South African Department of Health and the South African Department of Education. This program aims to set higher standards for peer education in HIV/AIDS. So you have before you a panel that is well prepared to engage in the conversation. And with that, let me pass the microphone over to Becky to give us some background on the HIV/AIDS situation in South Africa.
Good evening. Thank you, Suzanne Grant Lewis. First, I would like to mention that I'm privileged to be invited back to come to Harvard and share with you our present experiences after the apartheid has been destroyed. Harvard provided me with some knowledge, but I did not emphasize or think that I will face such a difficult situation at the workplace where I have to combat HIV/AIDS while trying to educate the learners. AIDS and HIV has destroyed and wiped out our generation in Southern Africa, as the former speaker has mentioned. It was estimated that by the year 2000, this disease would have infected 25.3 million people in sub-Saharan part of Africa, of which 4.3 million children under the age of 15 have already died, with 1.4 million with the virus. Looking at these numbers, this disease has now been regarded as most disastrous when counting other disasters that the African continent has had before. As you know, that in South Africa we have the Rainbow Nation, which means we have different racial groups, and also it means the presence of different cultures, values, customs, and norms. Under these conditions, to combat HIV/AIDS, it conflicts with the cultures, customs, and norms of different racial groups. I want to mention that on Thursday, the 7th, in Washington, D.C., at a business roundtable meeting, the Secretary of State, Colin Powell, commented and warned that HIV/AIDS epidemic in sub-Saharan Africa is threatening to wipe economic gains provided by US-backed aid programs in recent years. A class of individuals who were the managerial class, the teachers, the government workers, are all being decimated by this disease, with the infection rate that blind the imagination to the impact 38% to 39%, destroying societies. Archbishop Tutu once commented that we need to fight AIDS just like we fought apartheid regime that we had in our country. I tend to agree. Our struggle was successful because, he said, we had joined forces, and this, it should be in the case with HIV and AIDS. The joint forces, meaning people within South Africa and the international community, should help and join these forces to combat HIV/AIDS. Every day, thousands of people are being infected with this virus. On the other hand, tuberculosis is another giant. 1,600 children are infected with this virus every day. In the wards, in hospitals, 70% of the patients are HIV positive. They also have TB. Poverty has thrived. At present, the unemployment rate is 40%, and people who are without shelter, about 35%. Combining the two make an easy way of this virus to cause the massive destruction in the human's body as they become susceptible to a lot of diseases and reach the stage of AIDS quickly. You need to understand that indeed HIV causes AIDS, and poverty exacerbates the condition if one does not have food to boost their resistance. Again, the absence of shelter or overcrowded area became the good medium for the spread of the Mycobacterium tuberculosis, a bacteria responsible for causing TB. Looking at the national policy and the strategic planning, the South African government had delivered million houses to the needy as part of solving the problem. I want you to know that the workplace has turned out to be a horrible place for other AIDS sufferers. For example, Sibongile Shabalala, a teacher in KwaZulu-Natal, was diagnosed in 1997 and decided to disclose in 2000 she has been discriminated against because of her HIV-positive status. The school governing body decided to dismiss her, which really traumatized her a lot because she thought she was doing the right thing and hoping for support, but all she got was rejection. The South African Democratic Teachers Union and the Treatment Action Campaign and also the National Association of People Living with AIDS came to her rescue. Due to her being brave and coming forward, other 12 teachers have disclosed and have established the support group. Other employers have disclosed and they have established the support group. Other employers have come to realize that the impact of AIDS when it comes to their employees and the productivity. For example, the BIC company is one of these companies that has started to provide their employees with antiretrovirals. They have gone to an extent of having a specialist who will check the blood periodically to find out how the patient reacts to the drugs given. The other area of concern are the health workers, especially doctors, nurses, who sustain needle stick injuries from positive patients, and about 10 to 15% die out of this. It is good now that the post-exposure prophylaxis is present in all areas of health department. This is a combination of antiretrovirals that are given to a worker that has been pricked by a needle. This is a short background that I'm giving you and challenges that we are faced with in South Africa, most importantly at the workplace, such as schools, hospitals. And we do have a hope that good will come out of the engagement, since the South African government has agreed through the battle between THC that we had that drugs should be provided to the infected patients. I thank you.
Yes, thank you. Thank you, Becky, for that background. I'd now like to pose the first of the questions. This first one's a little more involved than the rest of them. So, and what I'll suggest that we'll start with Charles and then work down the line. I'd like us to now focus on the intersection of HIV, AIDS, and education. And Michael Kelly, a professor of education at the University of Zambia, has elaborated two perspectives for thinking about the intersection of HIV, AIDS, and education. The first is that focusing on education to prevent the spread of HIV, AIDS, and what has become known as the education vaccine. And the second perspective is the impact of HIV, AIDS on education, on the system, etc. Could you each in turn speak about where you place your work in relation to these two perspectives? Charles?
Thanks, Sue. My work is definitely focused primarily on the first of those perspectives, that education is an essential tool in combating the spread of HIV. And I want to say that what you see in South Africa and what you see in any country you can name is a hope and a reliance that mass media can do the job of educating and building awareness about HIV. And there have been some very good national campaigns on HIV awareness in South Africa as well, and well-funded. But that's awareness education, and that's got a very clear role, but it's not what happens when people need to talk about sexual behaviors face-to-face with people they know and trust. When kids need to talk about something that they now only talk about, if at all, with their friends in kind of informal ways, and often with inaccurate information. So I think that that we see and hear a lot of mass media kind of campaigns, and that's an important part. But unless and until quality interactive education goes on HIV and on sexual behavior and on all the other health issues, we're not going to kind of see the kind of downturn in the epidemic that we need to bring about. So the South African Department of Education has mandated life skills to be part of the curriculum in all schools as part of a larger course called Life Orientation. And teachers have been trained, and the country's taken some very sound systemic steps to try to make HIV education work across the country. And the work that I do is very much interested in the ways in which education can be used to combat the epidemic. Having said that, I do want to give you some idea of the impact that the epidemic is having on education as a sector. So that, for example, there are 443,000 educators in the South African Department of Education system, and available figures suggest that about 12% are infected. In South Africa, the epidemic takes on a different shape than it does here in the sense that it's not inversely related to income, as it is often here. And teachers are, have obviously much more disposable income than many other people in the population, as do principals and other administrators. And that, in some ways, does not reduce the risk because there is a fair amount of where money is, to speak frankly, where money is such an issue for so many people, especially so many young women. It's a major issue in terms of bartering for sex, and that's thought to be part of the explanation for why money and mobility has translated into high infection rates among some of the more resource people in the country. So that if there are 12% infected teachers now, we're looking at somewhere around 50,000 educators who will have died by 2010. And if the figures are wrong, and if they're higher, if they're 20%, we'd be looking at more like 80,000 educators died by 2010. And that's not talking about all the people sick and absent so the impact on the sector is enormous. On the other hand, just to say something positive, I think that having to cope with the epidemic has really brought about and hastened the introduction of educational reforms in South Africa, including the need to have more interactive education going on rather than lecturing from the front of the room, that is very constructive for all of education. And as well, I think that the issues of workforce development that the epidemic has stimulated will also help the country create some systems that will stand in good stead in spite of the epidemic.
Thank you. Alistair?
Thank you. Good evening, everyone. Let me just start off by saying that I think AIDS in South Africa has contributed significantly to redefining the roles of schools and of teachers in those schools. I think that outside of the core functions of teaching and learning and the quality of teaching and learning, the impact of AIDS upon school communities has been such that teachers or schools have been forced to evaluate their roles and create linkages with the epidemic that would allow them to effectively engage with it. And one of the things that we've been encouraging our teachers to do was to look at the roles of schools and of teachers in schools in a developmental context. The roles of our schools in terms of the socio-economic environment and some of its symptoms like high levels of poverty, illiteracy levels, malnutrition in our communities. And in the process of thinking and discussing that, slowly start to redefine what we should be doing. So we're moving further in terms of our responsibility as educators, further than just being facilitators of the teaching and learning processes in a classroom. let me just try to answer this question around education and the intersection of HIV/AIDS. There's education happening at two levels. I think, firstly, there's a rigorous awareness campaign that's being conducted by government and other agencies to create public awareness through the media in printed form around the epidemic and try and move people to understand it a bit more, and also to try and get people to engage with attitudes around the issue. And then the second area is in education itself, within the sector, the sector of schools and the tertiary institutions. The National Education Department and the provincial education departments have clear guidelines for how they're going to deal with the problem, with clear protocols that has been set out, and schools themselves, through the governing bodies, have formulated their own protocols. Basically, these policies are aligned, although there are inherent tensions within these alignments as to how we approach the issue at the grassroots level, at the coalface. But there is general alignment with what's happening, and so schools are looking quite seriously at implementing a number of different programs using different agencies and different groups coming in to work with them. Now, having said that, I think it's important that the idea that education only and education alone is going to effectively engage the epidemic, I think is one that should be carefully looked into again. I want to argue that within the broader developmental context of our country, it must be looked at within the context of some of the other challenges that we're facing. And as I mentioned earlier, it includes poverty, gender inequalities, education level, access to clean water, sanitation, proper housing conditions. And once we start discussing the epidemic within that broader context, I think we will identify other approaches outside of education, but linked to education, that would assist in combating the problem. And then just at the school level itself, the impact of AIDS on schools, Charles has mentioned a few of it. High rates of absenteeism amongst the learners, the students, and even the teachers. And we've noticed in some of our schools that that has been a significant factor that teachers look into quite seriously when they pick up these rates of absenteeism. Of course, this leads to low staff morale, and the functioning of schools themselves is always going to be affected by that. And then a concern of ours is the impact, and of course it's going to be a negative one, on the quality of teaching and learning that takes place within the school. And then, of course, the school is called upon to meet the increasing needs of affected and infected students and even teachers.
Thank you, Alistair. Becky?
Yes, in education, the role of the teachers has changed. The teachers has become the surrogate parents, because there is a number of orphans, or in a family of a student, you might find that one parent or a member of the family has passed away, and then the teacher should provide counseling. As my colleagues has mentioned, that the educators have to do quite a number of things to support the learners. And the teachers themselves who are HIV positive has to need the support from other educators as well. So this work in education, the impact of HIV/AIDS on education is huge. So if we have all these programs and neglect to practice some of the things that will help the people to alleviate or to prevent HIV to spread, the South African people will be wiped out. I would like to mention that the culture is one of the difficult points and challenges whereby a child cannot discuss sexual activities with the parent. As I stated earlier on, that the rainbow the cultural values are a problem when combating HIV/AIDS in South Africa, because some of the cultures do not allow the grown-up or the young ones to communicate with their parents or the grown-ups. Whereas formerly, we did have an infrastructure whereby the elderly person will communicate with the boys during the initiation, and the older woman will teach the girls as to how to behave in the society. As my colleagues mentioned, in education we are trying to bring in, because we have been talking about African Renaissance, whereas we want to bring back the African values and standards, but this has conflicted. It makes us to come back and review as to how to live with the old culture and values in these times of HIV and AIDS in South Africa. So that is a challenge of which we think some of the customs that we appreciated, like initiation, they need to take place in a healthy environment guided by the physicians, so that those elders will not utilize, say, knives from one person who is initiated to the next using the same instrument which spread HIV and AIDS. So educating people and the engagement of the South African government in combating the HIV/AIDS is not ending on publicizing it, but also reviewing these cultural values that we are intending to appreciate nowadays. I thank you.
Thank you. I'd like us now to hear about your work. And so I'd like to know, how is it in your work you define HIV/AIDS education? It's a lot of things, a lot of different ways of approaching it. Who is the target? What are the goals? Charles, would you start, please?
In my work, HIV education is defined as both information specific to kind of sexual experiences that kids are going to have. Hopefully you're trying to stay a year or two ahead of their experiences at least, with an emphasis both on, abstention, and if you're not abstaining, how do you actually engage in safe sex? But beyond that, or actually kind of beneath it, is all the kind of fundamental life skills, and I would argue kind of mental and emotional health issues and skills that you need kids to develop, whether you're fighting HIV or whether you're just trying to raise healthy kids. I mean, there is my colleague was talking about some of the kind of traditions, and the traditions in any of the cultures in South Africa seem to be that you don't really talk about sex, and we don't do it very well here either. And boys, and especially, but girls too, are not necessarily feeling that seeking help is a healthy and strong thing to do. And, relying on one's friends and feeling like one's friends are really about protecting each other and not thinking of health as a kind of an individual decision, that you kind of take care of your own health and can do that in a mass society. I mean, those kinds of basic mental health, I think, and emotional health issues are part of what HIV education is about. And I think the other thing we're trying to really rely upon is the fact that if kids are going to talk to other kids, let's give them the tools to have rational conversations, to have conversations where, with some structure and some reliability, they're going to have these conversations and challenge each other and need some kind of evidence and some science behind their assertions, and really kind of examine it critically. And that's good education, whether it's about HIV or it's about anything else.
Thank you. Alistair?
Just staying with the developmental context, I'd just like to point out that I speak from my experience as a school principal in a very poor community. The history of our country is one which created very, very deep structural inequalities. And so there are schools that serve middle-class communities, mainly white, who would be able to deal with the epidemic in a very different way and more effectively. So when I speak, I'd just like to, frame this discussion, my part. When I speak about many of the schools who are located in urban township communities or in rural areas. In terms of the way we see education, it's a program of education to promote awareness and understanding of the disease within schools, in classes, and geared towards different age or appropriate age levels. More specifically, I believe that the role of leadership in creating a consciousness within that school culture or climate around the issue is absolutely crucial. To bring that awareness home all the time, to reinforce that, is something that school leaders will seriously have to do if they want to create an ongoing and sustained awareness around the problem. I think that effective education, and if it is ongoing and sustaining and effective within the classroom and outside of the classroom, it should lead to a gradual change in attitudes and behaviors, which is the next step. Not only understanding information, but also the change in attitudes and behaviors. And in addition, an effective education about AIDS would counter some of the negative stereotypes and stigmas that are attached to the disease and cause people to run into a corner and try and hide it away. And then, of course, I do believe that the roles of our schools within a developmental context must also be to try and reach out through parents. And through doing that, looking at a whole family type of intervention, engaging with them, and making referrals to clinics and counseling centers that could provide professional assistance to the families.
Thank you. Thank you.
Yes, I will revisit the cultural problems on education. My target group at school is the age group of 14 to 18 years at high school level. We do educate them, as Charles has mentioned, that the curriculum is provided that sex education should be taught in schools. However, there are more in that we can do. There are programs like Love Life Games in sports where learners should exercise, get exercises, as well as the program of making them to be aware about HIV and AIDS. It has helped a lot. We talked about using of condoms, which is also a taboo in other age groups. But for teenagers, the statistics has proved that more learners are going to the clinic to take those condoms to utilize. We hope they use those condoms. But there is an ongoing debate where people, religious groups, and also from other communities, where they feel that this should not be done in schools, sex education should not be done because it encourages the learners to be sexually active. But the prevention using the condoms, seemingly it will be working, or it is working. But there is a challenge in other sector that I'm dealing with, the grown-ups in the communities. When educating people, we find that men are not eager to come up or come out or use the condom, because there is a myth that using the condom, there is the lubricant that is used is meant to spread HIV/AIDS. In KwaZulu-Natal, near the Msinga area, it is evident that about 5% of men, they want to come for counseling, the rest they don't, even if they know that they are HIV positive or they are sick. Only women who volunteer to go and take HIV test. Even then, if these women have found that they are HIV positive, they have a problem in culture to disclose, because it might happen that they lose their marriage because polygamy is part of the culture. The Zulus have more than one wife, and if one wife is infected, she will have a problem to disclose because it will be stated or assumed that she brought HIV/AIDS in the household. So these are the challenges in educating these people. Also, I want to mention that the healthcare workers in the program that I'm dealing with, they have challenges. First, men are not there for their partners, even if they know about their HIV status. Instead, they blame women for the outcome. So these are the challenges which one had to combat on a daily basis. Another part of AIDS education is looking at the unborn babies. As we have said, Charles and all my colleagues have mentioned that the generation, about maybe 80 million or thousands of people will be dead by 2010 if those people are HIV positive. But now we should focus on the unborn babies. There is a program, the Prevention of Mother-to-Child Transmission of HIV/AIDS, which is aimed at saving the unborn babies, protecting them from contracting the virus from their mothers. In the Church of Scotland, at Msinga area, this program, which was introduced in June of 2001, has proved that babies can be saved. We have some pictures here that I brought with me for display to show that these children have been tested recently and they are HIV-free. They are not HIV positive. So it means that this is a breakthrough. We can hope, we do have this hope that we are living with, that we still have a future generation and will be teaching in the years to come.
So can I just add one thing to pick up on something that Becky just said that just needs to be emphasized, I think, which is that the South African government is very, very clear, and the Constitution is more clear than any document anywhere else in the world, that gender equity and gender issues are critical and that you can't get anywhere in this epidemic or in development unless every effort is made to make sure that kids, that the law is very clear about all of this and policy is very clear, but that kids really have to understand this, and that the level that we talk about at schools, there's probably no more important part of HIV education than addressing the gender traditions that kids see in their parents and trying to see, help them see that we can't continue to live those traditions in quite the same way.
Thank you. Could you each comment on what you see are the biggest challenges for HIV/AIDS education in South Africa? For example, is it getting the message right? Is it reaching certain segments of the population? Is it the silence that surrounds HIV/AIDS? As you talked about, the cultural constraints, persistence of certain myths, like the lubricant and the condoms. And also, if you could comment on, do you think that these are challenges everywhere, or at least in other parts of the continent? Charles?
I think that the challenges you mentioned are all important, but I want to focus on a couple that don't get talked about a lot, I think, and that are particularly useful for maybe some people in this audience, if you're students here at the Ed School. Wherever you look, in any country you go to, there's just a tension and a gap between health and education. And, speaking as someone in public health who's been trained in education and worked in schools all my career, for public health, we absolutely, we have to work in schools if we want to work with kids, because that's where they are. And if we are content to simply work in after-school settings and only work in those kinds of settings, we're only going to get the kids who we can reach usually because they're the most motivated or they're engaged in something else and they're already in organized activities. So from a public health perspective, it's essential. The only way you can work systematically is to work in schools. Now, the schools obviously have other priorities and other things that they're working on, whether we're talking about in the U.S. or whether we're talking about in South Africa or any place. And they have a whole separate bureaucracy with a whole separate set of rewards and incentives and ways of evaluating themselves. Principals here, as you know, are going to be hired, fired, and paid according to what they get on, what their kids get on these standardized tests. And we can say till we're blue that most of that has to do with who the kids were when they came into the schools to begin with, but that's what the principals have to care about. And even in South Africa, in conditions of this epidemic, the teachers and the principals, they have other priorities, and the Department of Education has other priorities. So bridging that gap is just always going to be a challenge. And not only that, but it is a way in which, as a public health person, we think in population terms. But people in education, this principal has to think that every kid who comes into his school, he can teach that kid how to maximize his potential or her potential. Whereas in public health, we learned that if you create certain conditions in a society, in a community, I can't tell you which kids are going to live and which kids are going to die, but I can tell you how many. And that solutions are not primarily about individuals standing up and saying, I'm going to just make something of my life. They have to do with much more community, big issues in terms of community and some of the issues of poverty that and so on that Al mentioned. So that's one issue, is that, here in this university, there is much less contact between the School of Public Health and the School of Education than there needs to be if school health is going to be all it should be. And I guess the only other and some of that, as we were talking about earlier, has to do with issues of control and accountability and so on. So when you talk about schools being partners with community, they have to be satisfied that what's going to happen in their buildings on their watch is going to be high quality and accountable. And some of the community groups that come in resist those kinds of issues. They want to do what they need to do. And so these are issues that I think government has to be very much involved in. And how do you actually create processes that make it easier, not harder, for schools and community to kind of work together?
Mm-hmm. I want to probe the earlier comment you made in expressing how difficult it is to become the priority for a school or for a teacher. And I wonder whether a piece of that isn't that teachers may find it difficult to handle the subject matter or the methods, including this open discussion and being prepared for a question on whatever. And is that also a factor in?
Yeah, I mean, I think teachers here in this country, are still coming out of pre-service education much more comfortable with a controlled classroom than with a classroom in which kids are talking to each other. And in South Africa, certainly, the pedagogic tradition and the teacher preparation is for teachers to have a much more front-of-the-room kind of didactic approach. Now, that won't work in this because, in education, sequence is everything. And you may want to tell kids this is healthy and this isn't. But if you do that before you actually give them the chance to handle the materials, and as Al was saying, explore what their attitudes are and what they came into the room with and their conceptions, then they're just hearing a given message, and it doesn't matter whether it's a teacher or whether it's a very hip person from an NGO coming in or whether it's a peer educator, whoever it is. That's not the same as having kids get the chance to actually look at what they came in the room with and wrestle with it. And so, yeah, a lot of teachers are very uncomfortable with both the content of this and with the pedagogy of it.
Yeah. Thank you. Alistair?
Some of the challenges that I pick up, and I'm not going to add to what Charles has said, he's mentioned quite a few good ones already. The school constantly has to engage with the cultural norms in the community. And like Becky said, that is an ongoing debate. Then also the stigma that's attached to the disease I mentioned earlier makes people try to cover it up. And we've tried to answer the question, how do we create a safe environment for disclosure to happen within a school context? Then the capacity of under-resourced schools that serve very poor communities, the capacity of those schools to respond effectively to the epidemic is very limited because, like Charles has mentioned earlier, there are so many other priority issues. For example, crime and just safety on the school premises is a big issue that occupies the attention and the energies of teachers in many township communities. And then one of the other challenges is a lack of multidisciplinary intersectoral approach that effectively targets the grassroots unit. It's no use talking about these big fancy plans up there in terms of policy. How do you bring it down and how do you come together within the community is always going to be a challenge. And whilst there's progress in made on it, the tensions are always there. Charles has mentioned the tensions between health and education. And you find that communities become innovative, schools become innovative after a while. They start developing informal relationships with clinics, built on friendships and common interests around serving the needs of the community. And then, of course, like I mentioned earlier, the conditions within communities that are impoverished are always going to be a challenge to effectively addressing the issue.
Thank you, Alistair. Becky?
The challenges are enormous in the classroom. Charles earlier on mentioned that maybe there is no relationship between socio-economic status because educators as well, they are HIV positive. So it is a behavioral problem. Yes, in part I wanted to agree with him, but also to mention that in these cultural groups, you may find that there is one person who's educated, and the person, because we have extended families in other cultures, you have to take care of maybe 10 or more people rather than your immediate family, your children and your wife. So in that regard, you find that an educator who is affected because of poverty or constraints, financial constraints, it becomes difficult even when he is at the workplace to function. And also I want to mention that HIV/AIDS education is a very traumatizing disease. When you see, like in my school, you have to go and bury a learner. You have to conduct a memorial service time and again. And as my colleague has mentioned, the absenteeism of an educator periodically. He will come back, he's better, but again, he will disappear, go to the hospital. So there are these stressful periods in the entire staff in education, dealing with the subject matter, dealing with what you are expected to do as an educator becomes very difficult. Yes, the education system have the support providing and employing the counselors to visit school, but also poverty is there. Lately, there are recommendations on the policy that the feeding scheme will be provided even for high schools, because the juniors, those learners who do not have enough money to eat, it was provided for primary schools. But high schools, it is seen that the HIV-positive learners or who do not have families or parents, teachers, as I said, they become surrogate parents. They have to adopt a child, support, provide some talking, but it is not enough. So the government has engaged itself that it will provide some feeding for high school learners as well. Thank you.
Thank you. It's a good segue into my last question before we open up the floor to questions. Could you each speak about some promising approaches to addressing the HIV/AIDS epidemic through education? Doesn't need to be the glitziest thing you've heard about, but something that appears to be promising and effective. Charles?
Yeah, I'll just mention two things. And again, part of what is most promising to me about them is the scale. I mean, things need to be done at a large scale quickly if that's possible. And I think that with my colleague Sharlene Swartz over there, who many of you know, we've been working on this, trying to raise the standards of peer education, because peer education is an important technology, I think, for HIV education, both in school settings and after school, out of school settings, and in higher education settings. And we've just been very impressed with the way in which the country, the Department of Education, Department of Health, and the non-governmental organizations have responded to this attempt to try to articulate standards of practice for peer education. And another thing I will mention just quickly is that within the higher education sector, we are now moving close to a point where there will be required courses, particularly in the technikons, which are two-year institutions, so that sector can respond quicker because it's a national sector, and a curriculum that's developed for the technikons is used in the technikons all across the country, which is different than at the university level. And so within the next year or so, there will be a basic course that all technikon students have to take on HIV/AIDS and how it affects you personally, and there will be subsequent courses for people who are in human resources or in engineering or in local government or whatever you're actually majoring in that help you to understand how HIV/AIDS is affecting that sector and what you need to know if you're going to be working in that sector. And that's just a major advance compared to kind of what's gone on before.
Right. Yeah. Thank you. Alistair?
I think we need to explore the notion of developing the potential that schools have to become sites or hubs of community development and transformation. I do firmly believe that schools are still sites, like churches and mosques. Schools are sites of social cohesion. It's a place around which people gather around common activities and interests, the most important of course, being education. I'm saying that we should expand on that notion and look at developing strong school community partnerships, both within the communities, but also across communities, across government departments, across the non-profit sector. I think that kind of interplay will bring out the potential of schools to actually engage with the issue within the communities. Schools in township communities are fairly big. In fact, most of them have over 1,000 learners in them. And just to give you an example around the student-teacher ratios, at our school we have 1,241 students, and we have 30 teachers. 30 teachers. And the principal teaches in a class alongside the other teachers. Now, obviously, in a situation like that, schools will not be able to do it on their own. And so when we argue that schools should become the hub of community development and transformation, the schools don't drive it themselves. They become a site. It becomes a site through which that happens. And these kinds of collective partnerships will then define the direction that they're going into. I think that's an important approach. And we started that 5 years ago, and it blossomed into the Safe Schools program, which seems to be expanding. I just want to close with my own personal experience around one incident, and then I'll be finished. At our school, we've developed these linkages, but we've also set up what we call a teacher support team. And what this team does, it monitors attendance at school, and it also monitors behaviors in the class. And so if there's a child that acts up, that gives problems in the class, or that stays absent on a regular basis, this student gets referred to the team who then discuss the issue. And sometimes they will call in the parents and with the kind of networks we've built, be able to make the necessary referrals. One day they approached me to ask me to do a house visit. There were 2 girls in the school, one in grade 1 and one in grade 3, 2 sisters. They'd been absent on a regular basis and there was no contact the parent made no contact with the school, no letters to inform us, no doctor's letters or anything. And they asked me then to go and do a home visit, which I did. I went to visit the family and tried to inquire as to why. Firstly, spoke about the importance of education for the children, and then tried to inquire why the children were absent. And the mother was at home, and she spoke to me. She was very aggressive and very defensive. And for half an hour, we were going to and fro around the importance of education. And then suddenly she broke down crying. And she told me that she had AIDS. And she was given about 8 months to live. And then she went further to say that her husband also had AIDS, and he in fact infected her. And the reason why the kids were at home is that their world had just fallen apart. But they'd just fallen apart. And she was trying to hold on to them for as long as what she could, knowing that she may die soon. So then I spoke to her a bit longer, and I asked for a consent if I could refer this in confidence. Another big issue, confidence issue. In confidence to the school and also to the clinic. And so we managed to bring the whole family out in a safe environment to do a referral with the clinic, to be aware of the problem with the children in the school, because obviously it's going to impact upon their behavior and the way they learn in the class. To manage to become aware of it and to monitor the situation as it, I wouldn't want to say progresses, because in this case it deteriorates. But there the school could serve as a site to actually do that referral. And one or two other things have also happened that allowed us to work in ways like this. So I'm hopeful and I'm positive. I just want to close by saying this. In South Africa, we believe that the last phase of the struggle for freedom and liberation was ushered in by the student movement, by the schools. When from 1976 onwards there was an uprising, a mass uprising led by the students that we believe forced the apartheid government to the negotiation tables, or contributed to them going to the negotiation tables. And so I, in my lifetime, being part of that student movement, I've witnessed the power of education in engaging a system as oppressive as the apartheid system and in overcoming it. So I believe that we can do it with AIDS too. At the end of the day, we will say, like we always do at home, schools give hope. And in South Africa, that really is and should be true.
Thank you, Alistair.
Thanks.
Thank you. Becky?
I'll be very short. The change in mindset of men will help South Africa. As we have said that they are dominating in the lives of many households or life of the people of South Africa in most cultures. So the partnership, men in partnership in combating HIV/AIDS, and if they change their mindset and accept that this killer disease is really destroying the entire nation, and alleviate and remove in their minds the myth of condoms and the myth that if a man who is HIV positive sleep with a virgin will be cured, and also running to the traditional healers with the hope that the HIV will be cured and eliminated from his body. If they really, men are committed, we are getting to a better life. In schools, we know that we are saying to our students, they should abstain. They should abstain, and also we are saying the religious leaders should preach the gospel, not saying people should condomize only, but they should abstain. The youth should wait until the right time so that they'll be able to make proper decisions. Another hope that we have, Neverapin, the program of MTCT, has proved to be a success, so we know that we have a future generation. I thank you.
Yes, thank you. Thank you to the panelists. I'd now like to open up for discussion with the audience. Ask your questions. Sir?
I want to pick up with
There's a microphone.
I want to pick up with the idea that the successful movement against apartheid was based on activism and struggle. And the approach that educators are taking to HIV is largely that it's a matter of individual behavior, individual choice to prevent infection. And it's not putting a political spin on the disease. For example, the question of treatment. Becky has referred to the Treatment Action Campaign, which has led the campaigns in South Africa to have mother-to-child transmission prevention. It's led the campaigns demanding a treatment policy by the national government. It's helped to lead campaigns against pharmaceutical companies to get cheaper medicines and against the U.S. government to reduce trade barriers that would permit access to cheaper medicines. I guess the question is, shouldn't part of the part of the educational agenda be to arm students with a treatment consciousness, to a human rights perspective, that people have the same right to treatment in South Africa that people have in the United States, and that the barriers that are created by the South African government, by the U.S. government, by the pharmaceutical companies should be fought against, just as the South African population fought against regressive policies in the past.
Thank you. Who would like to tackle that one? Go ahead, Becky.
Yes, I think that is the approach, the route that we should take. As my colleagues has mentioned, that the freedom has been acquired through a fight. And TAC has proved that, because the win and the availability of this nevirapine drug to be available for the pregnant women, it was through the TAC, which fought against the government, even right up through the court. So I think the students, if they are given, it is difficult that students can be given the treatment for free, because the health policy and also the drugs are not given to everyone. So what I'm trying to say here, we don't have the health insurance that covers each and every individual in the society or in the country. So until the policies and forces or the government provide insurance for everyone, then these drugs will be available and people can stand up and fight to get them.
Yeah, I just want to respond to you, not in the context of treatment, but in the context of, I completely agree that with what Al said, that the youth played this pivotal role in making, in the transition to democracy and in defeating apartheid. And when we talk about what peer education should be, we're very clear that there are 4 roles, and one of them is activism and advocacy. And so we're definitely saying, it's not about keeping your own body safe. It's about, if you're in a school and you know that, your girlfriend or your sister or a girl, is getting victimized by sexual harassment and kind of the things that go on, this is not something that you act as a bystander about. You take action, and you take action in a group. But realize that this is threatening. That to say to people in schools, to teachers in schools, we really want to get kids to feel like angry and efficacious about taking their issues in hand. And, this is not, the least threatening thing you could say to a principal. You may really appreciate it, but there may be principals who don't. But I definitely agree with you. I think it's absolutely critical. And what Becky was saying about changing the way men and women think when they're kids about this stuff is this is how it happens. It's not just talking about it, it's doing it.
I think activism is important for two reasons: to put pressure on government, but also to create awareness. We put the government in place. It's our government. And in a healthy democracy, you're always going to be able to interact and engage with that government. And so that is what we're doing. And I believe that there's a groundswell of activism that's still occurring in the country. That's good. And hopefully we'll continue to put pressure on government to look at the needs of the people. I also just want to throw in something here. In our transition to the democracy, a lot of our community leaders were taken up, not only in government, but to head up many other institutions. So that there was that transition of leadership into institutions, into government, and that left a vacuum within communities that has taken a bit longer to fill, of the new leadership coming through and then lobbying and doing advocacy work, becoming active. So that has, to a certain degree, limited the extent of activism. But I do believe it's there. It's important not only to get government to be aware of it, but also to create awareness within the communities around those issues.
Thank you. Another question? Yes. Sorry. The microphone's coming.
Hope you don't mind if I don't stand up. It's just going to make me nervous. I had the opportunity to do some AIDS education in Ghana, and I'm writing a thesis now on AIDS education for women in Ghana and South Africa. So I was wondering, in response to what Dr. Deutsch said about the South African Constitution and how it has plenty of provisions for gender equity, what sorts of experiences you've had in schools in South Africa seeing gender equity programs or something to empower women, to make boys see them as equals and to make them feel like they're equals, and also if you think that AIDS education programs based on women's behavior as opposed to based on men's behavior can be effective, because I know without the gender equity you have the problem of they don't have the right to say what they want in a relationship, or that they want condom usage or whatever. So experiences you've had in the schools pertaining to gender equity.
Thank you. Do you want to go
So
first, Becky?
what we try to do, especially in my school and the schools that I know, we give the women, the female students, the positions and some tasks to do so that they will be able to speak out for themselves and also to take a lead. Because it is difficult, as Charles has mentioned, that yes, the ANC government has a policy that 1 into 3 positions, one should be a woman. In 3 positions, leadership positions, they should be right up there. So we are trying to do that in schools, and also speaking with any other type of leadership, RCL or student leadership. So we want the women to be part of that, and we encourage our students to elect women, even if female students, so that they will have an opportunity to have their own voices heard. Thank you.
Okay, thank you. Anything to add?
Yeah, just to add that, in an approach like this, gender equity cannot and should not be divorced from discussing AIDS. So these issues should be looked at and dealt with collectively. So just in terms of an approach, looking at how you could visibly move into creating equity for women within our institutions has been something that a number of schools have taken on, even in policy.
And I could also add that I think the debate has started. The July issue of Perspectives in Education, which is a South African education journal, has 2 of the the whole issue is dedicated to HIV/AIDS education, and 2 of the articles are dealing with gender. One in terms of addressing it through the curriculum, gender inequalities and gender relations. The other one, by Fiona Leach, is saying schools are no place for addressing HIV/AIDS because they're hostile to females, and that the whole there's a contradiction in trying to locate HIV/AIDS education in schools which are, by their structure and practices, bad for girls. So it's an interesting discussion. Another question? Yes.
Taking from the example that you spoke about concerning TAC, had to go to the High Court to obtain a directive to give the nevirapine to pregnant mothers. It seems as if there's a lot to be desired from the government, South African government, in as far as showing leadership in the fight against this pandemic. What I would like to ask the panel is, first of all, can you first confirm what is the attitude of the government concerning especially the agency concerning this pandemic? And the second question to that is, while I do agree activism and advocacy is important from the grassroots, are there any other form of pressures that could be applied from outside world to the South African government to make sure that maybe they take more drastic steps to address the issue?
Thank you. Becky?
First, I will say that the outside pressure has come in many forms. There is money that has been provided for and directed to KwaZulu-Natal to combat HIV/AIDS. Although it has sparked the controversy on distribution because of the policies that were not followed by the MEC or the Minister of Health from KwaZulu-Natal, but that has been taken care of. The money will be distributed throughout all provinces on agreement that the sponsor agree that it will also be available to other provinces. And on the issue of TAC, I would like to mention that the political statement made by the President himself earlier on the issue of the link between HIV to AIDS and poverty. It has been a political statement mentioning or soliciting some help from the external, from the outside forces or from the international community to say, come and help, there is poverty. It was just a political statement, although the President has resisted up to the point where the TAC has to win the battle in court. I thank you.
Thank you.
I guess I just want to emphasize that while I think the President's positions have had real impact in the, and especially in terms of allowing some of the traditional leaders, as Becky was saying, to kind of continue to promote practices or to condone practices that are deadly. I think that South Africa is just full of people in government and outside of government who are just working their tails off and doing some great work against the epidemic. And my impression is that one of the major problems and one of the major headlines always in the papers is when departments don't spend their money. It's a headline when kind of money, especially money for HIV, is not spent. So it doesn't look like the main problem is lack of funding. It's that capacity gets built slowly, and that includes the capacity to deliver these systems, both for delivery of medication and delivery of education, that actually kind of reach the people they're intended to.
Thank you. Anything to add? No. Okay. Yes. There's a question down here.
A lot of young people in the United States and elsewhere are very concerned about this pandemic and are interested in helping if there is a way to help. And I think one of the questions that many of them have is there a role for people from the outside to come and help in Southern Africa? Or is it something better dealt with within the countries and by just sending money to NGOs that are already there? Or is there a role for, say, a generalist, say a young college graduate who would want to go down and help for a year to do something either in education, particularly in education, when you talk about the taboos, when you talk about the stress that the teachers already have with all else that's required of them, is there a role for someone like that, and how big a role is that?
Great question. Yeah. Becky, you start?
I think there is a platform for the outside help or contributions. I will give an example of teacher empowerment. It's outside the Department of Education. It's not something that is done by the government. But there are people who have volunteered, like Judith Baker, who has volunteered to empower educators on reading and writing skills. That has gained popularity throughout the province of KwaZulu-Natal. The results has improved, and the government, the national government, has recognized the impact that created by these efforts. So if there are volunteers who are willing to contribute, conscientize, and give another side from the outside world, how do they look on the cultures and these taboos and talk about it, that will help tremendously.
I just came back from I was from South Africa about a week ago, and I did a workshop in Al's neighborhood in Cape Town area, and there was a young man there who was born in South Africa but has lived in the States for years, doesn't speak any language but English, is a student at University of California, Santa Cruz. And he was doing a semester abroad that has evolved, I think, into a year abroad, and he was being extraordinarily useful in playing that role. Now, one caveat I'd like to say to so I think that there is a role, assuming that you kind of walk with humility and remember it's not your country, and also that you that where the volunteers are needed are usually the places where volunteers are least likely to want to be, and where other folks within the system. I mean, they're having a real problem in South Africa getting trained the excellent teachers and trained teachers up to some of the rural areas, or some of them, and so it's the distribution of folks. And so if you could get some volunteers who actually wanted to go to places that were really least resourced, away from some of the big cities, especially a city like Cape Town, I think that's where they'd be most needed, is my impression.
Can I just have a quick follow-up? And what kind of contact would you make? Who would you talk to about trying to identify those places and what to work through? Ministries of Health?
No, I would say
Ministry
more
of Education? Church?
Church groups, and if you know people, you just go there and start a project like I've mentioned Judith Baker. And also I would like to mention directly the engagement, especially in TAC, Professor Brooke Baker, who has been involved and been instrumental in South Africa, leading, participating with many people, forcing the South African government to allow the distribution of nevirapine. So yes, this can be done. He may contribute as to how he did it, how he was able to participate and engage in this activism.
Thank you. I just think two things around your point quickly. I think that students have a role to play here in terms of internationalizing the debate even further. I'm not sure how strong the whole issue around AIDS the issue is held in schools or universities. So I think that could be strengthened from an international perspective. And then, Charles and Becky have mentioned the whole fact of community service in communities in South Africa. The United States has a history of contributing to nation building. And since 1994, well, even before that, students have been coming over on a regular basis to work in different communities, and that must continue. that should continue. There are lots of structures that have been set up for that, and our experience have taught us that a good situation is for students to come into communities to do community service, to have a real lived experience of the context of the community. And not only does it benefit our country and the communities in which they work, but for the students themselves, they have an opportunity of engaging in a context which is very different to theirs, with mindsets that are sometimes very different, and just a mirror of which to reflect where they're coming from in terms of the assumptions and values. And for some students I know, it's been a life-changing experience. And besides that, also a beautiful country to be in.
Please.
We have time for one last question. Jason, do you have a question? He got them. Did you have a question?
Thank you for that. One might also mention that even less resources are further up the continent than South Africa, but also less desirable to go to in some respects. I was living in a community in Zambia where I came to, I guess, appreciate a little bit of what you were talking about in terms of the school being, its influence in society changing and becoming sort of a hub. And that drew me here to Harvard. And I don't know if you knew this when you mentioned about the gap between health and education that you're talking about, but here at Harvard there's a huge gap in the understanding. I mean, if this was at the medical school, I mean, there's huge amounts of money and resources and all kinds of things. I was wondering if you guys had a theory about why the in academia here in America, certainly, there's very, very little interest in HIV/AIDS in Africa.
In the medical community?
No, in that academic world, particularly, I mean, in education.
I should have an answer to that. I mean, I've done work for years for the CDC trying to understand how higher education could actually be enlisted as a much more effective strategic partner in improving the health of kids than it is now. So you know, if you're here at Harvard, that all major United States research universities are organized the way Harvard is, every tub on its own bottom. And you would almost think that they were designed to keep people from working across disciplines and on actual problems with actual solutions. Because, you know, the claim that most people have in America of American universities is that they are very busy stroking their chins and studying problems and very little helpful in terms of solving them is the typical, you know, kind of reaction of the community to universities. And partly you can see that that the single discipline, you know, the attempt to get somebody to focus entirely on their discipline and really devote 30 years of, you know, research and you know, to that discipline, you know, has had a lot of benefits. I mean, it's not a crazy idea. It's just that in this age that we're in now and the kinds of issues we're talking about, and HIV/AIDS being, this is harder than rocket science in a way, you know? And it takes a coordination that many other problems do not require. But the universities are not set up for that. They're set up as special, separate fiefdoms. And you know, you can be not just in a school and not have contact with other schools within that institution, but you can be in a department and not have very little contact with folks in the same school. And now we're not even talking about can Harvard work with BU and can Harvard and BU work with UMass and Bunker Hill. I mean, you know, there's no inherent reason why that shouldn't happen, and the problems that we're trying to address in this room here today, for example, demand that kind of collaboration happen, but the institutions have not been set up that way, are not rewarded that way. The reward system is completely counteracting that kind of process, and these institutions are very hard to change, very slow to change.
But having said that, let me announce that on November 25th, there is actually a conference that is across the university schools called the Harvard Programs on AIDS in Africa, a University Responds. It's going to be November 25th at Snyder Auditorium, and there will be presentations about research, training, and public health activities in which Harvard is involved in Botswana, Nigeria, Senegal, South Africa, and Tanzania. So at least there's a first conversation across the schools that's going to take place, and I believe it's public, and His Excellency Kenneth Cohen is expected to be keynote speaker at that conference. You can get more information on that at the Harvard AIDS Institute website or the Committee on African Studies. We'll have that posted. Yeah, that's really great
right before
timing.
Thanksgiving.
Right.
And I want and I don't know anything about it, Sue, and I'm over in the medical area.
So it's some people know about it. Now you know about it, and now Charles knows about it. We get Charles on the program. Last question.
Well, this isn't really a question. This is in response to the idea that people in the U.S. can mainly help by volunteering, which I think is a wonderful thing, which is how I got involved in South Africa to begin with. But in point of fact, with respect to HIV, there are practices by our own companies, our own government, that are standing in the way of full access to treatment and effective care and prevention. And another thing that people can think about doing is educating ourselves about the practices here that prevent success in fighting HIV/AIDS pandemic in Africa. What is it about our trade policies and our intellectual property rules that prevent access to cheap generic medicines? Right now, the U.S. government is trying to negotiate a new agreement with South Africa which will prevent the importation of generic medicines. Why is our government underfunded the most promising funding mechanism for fighting HIV/AIDS, the Global Fund to fight HIV/AIDS, TB, and malaria? Why do our multinational corporations not routinely provide treatment for their workforce in Africa? These are questions about that are home where we are, where we can fight to help our brothers and sisters who are dying here with respect to policies that we are, that our proxies are making. I'm all for solidarity and actually volunteering and for people going and find out much more about South Africa or any African country. But another way of knowing about the conditions there is to understand what's going on here that has impact there. And if people want to have a commitment to making sure that education to prevent HIV is more effective, then ensuring that our government and our companies are doing things that enable that to happen will also be important. So I just want to encourage people to fight the good fight, not simply volunteer to go across the ocean.
Okay,
Thank you.
Thank you so much. I wanted to certainly thank each of the panelists. It's a compelling and wonderful conversation. I'm sorry for the need to have it, but find it really remarkable sometimes that the people who do the hardest work are often the most hopeful. It's a paradox that I continue to puzzle over. But in case you missed the name Judith Baker, which came up about 1 million times tonight, I wanted to say how remiss I was in not thanking Judith Baker, who is working with the Madison Park School Site Council of Cambridge and was, I think, really the heart in bringing this forum here today. So thanks very much for that, and also for the Teachers Network who co-sponsored this with us. But thank you all for coming. I'm sure the panelists will remain around for a few minutes if it's easier to ask your questions in private than it was in public, and thank you all for being here.
Thank you.